Welcome to Finding Your Balance, a mental health podcast. My name is Tiffany Fritzsche. I'm a licensed mental health counselor. I'm joined with Kirk Fasshauer, licensed clinical social worker. And this is part 2 of a podcast regarding suicide awareness. As we said before, this is a very sensitive topic, and we want to make sure that you take care of yourself. That might mean taking a pause and providing some self-care, stepping away, taking a break. We're going to go slow on this podcast and go through the topics because they are sensitive, and we understand they're sometimes very difficult to hear. Now, Kirk, walk us through briefly regarding the first part of what we talked about just recently.
Yeah, so we got into a little bit of some statistics, some of the process that somebody might be going through or experiencing with the depression and thoughts of suicide. And we started to get into, I believe, we talked about a myth, some of the mythology behind it, that prevent people from even having that conversation and how important it is. And that we're talking about a different level of pain. This is an emotional pain, not a physical pain, which often is very difficult to describe, and just kind of bouncing off of that to get more into what we're talking about with suicide is, again, trying to, from somebody who might be experiencing the thoughts of taking their life. They don't want to be perceived as a burden to their friends. They may have lost some connectivity to things they once loved and did for various reasons. It could be stage of life kinds of issues. And I know for some people, they believe that, depression is part of getting older. And it's not. It's not a normal phase of getting old at all. I mean, I know many geriatric individuals who are quite active and quite involved and not depressed at all, and that's the vast majority of folks. So depression, sadness, isolation, those things are not normal.
Well, and it's hard because, a lot of what we talk about is life transitions. And there's transitions everywhere because we get older, but also relationships change, life situations change. And so there is a natural transition that happens when things change. You grieve a loss, and then you have a little bit of anxiousness or nervousness because something new happens, but then you find your balance. And I think life is nothing if not adjusting and constantly finding your balance. And where do you kind of draw the line between this is just part of life and adjusting and trying new things and life being hard, and then the other part of that where, no, this is not part of this. This is something different. And we've talked in earlier episodes about really the difference in mental health and mental illness, and where's that line where this is a bad day versus this might be depression. And you mentioned in the earlier episodes about when you look, for example, at depression, depression is not I had a bad day. Depression is something that affects your overall functioning in a way that it doesn't get better usually by itself. Right.
And it's a long-term kind of thing. So a bad day is something with good self-care you get over. And, it's spilled coffee, traffic jam, late missed deadlines, things like that. But when it becomes more of a mental health kind of crisis, it's longer term, it's persistent, and it's kind of, sometimes it can start off as a small drip, and it gets bigger, and things happen like that.
And it's not that you're not trying. You are trying, and you're trying all the things, and you just can't get on the other side of it. You talked earlier in the prior episode about some myths associated with suicide, one of those being, I don't want to say anything about it because it might put the thought in that person's mind. And we know that's just not true.
Right, absolutely. And, and some people say, it just happened without any warning. I mean, that's another myth that typically there is. And actually, one of the bits of research conducted with the American Association of Suicidologists found that individuals who died by suicide had actually seen their primary care physician within a month of their suicide. Yet, questions weren't asked about depression or about suicidal thinking. So in the past, I want to say, past decade, you have started to see those questions on the questionnaires when you go to the doctor's office. We're all subject to it now, which is great. the question is there. That had to do a lot with the efforts of groups like the American Association of Suicidologists getting out there and educating primary care physicians on asking these questions, combating the myth of, oh, if I talk about it, it puts the idea in somebody's head. And it has made a difference. I mean, it's not going to prevent. Nothing is going to be 100%, but it has reduced it to where, they check off the box and they have that discussion. Yes, it's a self-report, and so I'm sure some people are saying, well, I could just lie. Yep, they do. But again, that's who you're lying to.
Yeah.
And what's the psychology or the thought process going behind that lie? You don't want things to seem as bad as they were. You don't want to lose some freedom because, the intervention for preventing somebody's suicide can be pretty intrusive. Yeah. And so people are afraid to go down that path too. And often too, another myth is that, well, people are going to who talk about suicide, they're fully intent on dying. And it's not about that. The intent is to stop this emotional pain, this psychological pain, which we talked about in the previous episode. It's rather difficult to discuss. How do we talk about this with somebody who doesn't really have a frame of reference for what I might be experiencing? Mm-hmm. And everybody has a different experience. We may have been witness to the same thing, but your experience and my experience are going to be very different. And it has to do with, our upbringing. It has to do with our social class even, the friends we hang around with and things we read and get involved in. All these factors tie into our frame of reference on things. And so that makes the same event look very different in everybody's eyes. So it could be that we have an experience and one person may contemplate taking their life versus somebody who doesn't. So it could be an event. It could be excessive loss. What we do know is with some of the risk factors that are there, what you want to watch for are some recent losses. I mean, they're not some of these factors, some of these risk factors in and of themselves are not by themselves. They're not like, oh my God, I got to worry about this person taking their life. No, but when you start to see some things cluster together, so you've got somebody with a lot of losses. Are they feeling kind of trapped? Do they start to isolate themselves? That's when you need to start to worry. And when we do part of our assessment process is asking about isolation, because I think isolation is a big factor here. And as a matter of fact, a sociologist by the name of Emil Durkheim did a sociological longitudinal study, longitudinal being it took place over a long period of time, looked at suicide as a social issue, not just a personal issue. And he published his findings and his study in a book called Suicide. It's always interesting having grad students walking around with a book that says suicide in big letters on it, raises some eyebrows. But it's actually a pretty decent bit of reading with regard to the topic. Excuse me. So what Durkheim found in his work, a lot of it still holds true today. Yeah. One of the bigger factors that really stood out for me was the whole factor of social isolation. And if you look at the rates of suicide across the United States, those areas that have higher rates of suicide are those areas that have low social populace, a lot of social isolation. And so that's like, wow. So, for example, Alaska is ranked number one in the nation for rates of suicide. Alaska. There's not much going on in Alaska. It's very isolative, especially during the winters. There's a lot of access to alcohol and a lot of access to guns. Not a good combination. And when you're isolated like that, you are stuck with yourself lots of times, and that can be very difficult for somebody, especially if they are in a negative mindset about themselves and who they are and their value in the world. And those are some things you need to watch out for. Purposefulness. Does the person have a sense of purposefulness? Alaska's been number one in the ranking for many, many years. They continue to be number one for right now. The lowest in the 20 plus years that I've been following the suicide trends, Alaska's only gotten as low as 3. But that particular year, there was a lot of effort and focus on how do we reduce that through education and talking to people in those communities and reaching out to they've got a high Native population there that tends to be at risk. So, that helped tremendously, just starting the conversation, believe it or not.
Well, and what you said about community, I think that it rings so true because we've talked before just the impact of presence and just being together. That's huge. And it's not being busy. I think that you can be social and be busy, and that's going to increase some dopamine and some endorphins. So that's going to do something. But it's not just being busy. It's feeling connected, feeling like somebody knows you, that you matter.
Right. It's about being present as well, because I talked about, I think in the last episode, talked about, we put on a good front. We put on a mask. And people who are struggling with emotional pain put up that mask a lot, and people go, I had no idea. They seem so happy. And it's sometimes you get a friend that sees the crack in that mask, and they don't ask because they're afraid to lots of times. But if they ask, there's such a wealth of information there. And, even when you ask, are you contemplating taking your life, or I'm a little more direct with that, but I ask that question multiple times a day, is are you going to kill yourself? It's some people may deny it, say no, but a message has been sent when you even ask the question. I'm here. I see you. I see you, the real you, and I'm here to help you if you want it. And so people can step forward and cross that threshold into getting the help. Because there's some people that, and it's a small percentage that won't cross that threshold to get the help. That's the reality. There'll be indicators, and even with those indicators, like we've talked about, the purposefulness, the anxiety, the thoughts already being there, the social isolation. You'll notice also some reckless behavior, and I'm talking about lack of regard for one's own well-being, and that, and I'm not talking about people who do some risky stuff like jumping out of airplanes. That's a kind of when I present this, I talk about, I got friends that skydive and they get into a perfectly good airplane and jump out of it.
Well, and that's a good point, because you're looking at what's the motivation behind it. Because two people can do the exact same thing, but the motivation behind it really determines what's really going on.
Right.
And so what I hear you saying is, for a lot of people, and I work with teens and I work with kids, and I see whenever I'm concerned about when we say suicidal ideation, what is that? That's thinking about suicide. I see a lack of motivation. Sometimes I see some deficits in hygiene, right? Because what's the point? Why does it matter? It's not uncommon to see an increase in depression. And when you see depression, what do? You see lack of energy. Yep. You see lack of motivation. You see lack of initiative. And it's not that someone's being lazy. It's not that someone doesn't care. They care so much that the pressure of caring is crushing them.
Exactly.
And that is too much to bear alone, and it can feel like it's crushing you. I've talked to individuals, and they've said, literally, it feels like my body is made of lead, and I want to get up so bad I can't get out of my bed. Because the weight of caring is crushing me. And when that happens, sometimes what you need more than anything is that friend to reach out. And so, if you're listening and you're saying, well, I'm not a counselor, I'm not a therapist, I don't know what to do. What do I do when I have these concerns? Sometimes it's as simple as saying, call your friend, text them, hey, I haven't seen you in class today. I miss you. What's going on? Right. And it doesn't necessarily have to be, a very, very serious conversation. Sometimes it's just reaching out and saying, hey, you matter to me. I noticed you weren't here.
Right.
That can be life-changing.
Huge, huge. And there's actually been some studies done on those individuals who post-hospitalization, mm-hmm. so individuals have expressed suicidality, they've gone into the hospital. They've done some studies where something as simple as a handwritten postcard mm-hmm. mailed to them, I know this is an older study, mailed to them that says, hey, we just wanted to follow up with you, make sure you're doing okay today. That statement, that card, that little postcard in the mail to that person within 24 hours of their discharge makes the world of difference. Mm-hmm. And you think, well, it's just a postcard, and don't fluff off the small stuff like that, because you're right. Just reaching out and saying, hey, didn't see you in class today, thinking about you.
You matter.
It's just enough to send the message that they do matter, that somebody is concerned about them. And you don't have to have the alphabet soup after your name, Mm-hmm. You can do some things very simply to reach out and just say you're concerned.
We've talked in earlier episodes about automatic negative thoughts, ants, right?
Yeah,
so
ants.
One of those automatic negative thoughts is, well, it doesn't matter. Nobody would notice me if I was gone. Like, it doesn't matter if I'm here. And that is one of the ones that I hear most often. Well, nobody would care if I wasn't here. And that postcard absolutely just takes away, that argument. Like, we care. We notice that you're not here. So if you don't, like what you said, the alphabet soup, if you don't have that, it really is finding ways to strengthen connection by making a phone call, by texting, by letting mm-hmm. people know they matter. I know one of the big things, just like simple things for new moms even, and, you have that friend that comes over and folds your laundry while you're holding your baby. Let the new mom hold the baby while you fold their laundry, while you do their dishes. Now, you can't do that for everybody because it would be weird to show up at somebody's house and do their laundry. I would love that. But just finding ways to connect, and it doesn't have to be so intricate. Yeah. It's just showing up for people. Now, if you are in that situation and it's past the point of, hey, are you okay? And you have to ask a question or you're concerned, I know a lot of people wouldn't know what to say in that moment. Right?
And they're afraid they're going to mm-hmm. say the wrong thing.
Yeah.
I'll tell you right now, the wrong thing to say is nothing.
Right.
Don't say anything. The wrong thing would say, I double dog dare you to do it. That would be a wrong thing to say as well. Don't challenge. But the thing to do would be to really ask, first and foremost, ask the question of, are you thinking you might kill yourself? Are you thinking about suicide? Ask that question. And it, again, easier said than done. I say it a lot. I ask the question a lot. My team asks the question a lot, so it rolls off their tongue fairly simply. But even doing it for a long time, it's not an easy question to ask. So asking somebody who's just, I don't know what to say, and I'm going to say this, and then they're going to be offended. And it's like, I'll tell you right now, I'd much rather have somebody offended that I've asked the question than not ask it and have a dead friend. So ask the question. It can be awkward. I mean, it's okay, but get the question out.
And you can fumble it. You can say, look,
absolutely.
I don't know how to ask this, but I can't say nothing. I care about you. I see this letter. I see this post you just made. Are you okay? Or are you thinking about wanting to die?
Right.
It doesn't have to be perfect, but just opening in that dialogue, opening in that doorway to allow them to respond.
Exactly.
That's huge.
Absolutely. And you have to be ready for the response. Mm-hmm. And I tell people you might get different responses. You might get, no, what do you think? I would never think that. Yeah. Good. Opportunity for dialogue. What are you picking up on that you're worried about with your friend? The other one is the yes. Now you know what you're dealing with. I want to get you some help. Partner with the person to get that help. Don't just leave them alone. Don't say, oh, we'll keep it a secret. We're not going to tell anybody. Yeah, you're not going to go out and shout it off the rooftops. Oh, my God, this person's talking about wanting to kill themselves. You're not going to do it that way, but you're going to get other people involved. You're going to reach out through resources like 988, the lifeline, the national lifeline that's there, the suicide hotline.
If you're at school, a campus counselor.
Somebody in the clergy, wherever you get somebody else involved, because it's a burden for the person experiencing it. It's also going to become a burden for the person, not so much a burden, but it's going to be hard and heavy for the person experiencing it. It's going to be hard and heavy for the person hearing it, and they shouldn't do it alone.
Right.
You've got resources. You should partner up with those individuals. 988, the local, with Peace River Center, it's our 863-519-3744 emotional support line. These hotlines are effective in that they are somebody you can reach out to, whether you're experiencing it and you need to call the number, or you've got a friend that you're working with and you call the number. You can do it in partnership and together. And that sends a message to the person experiencing that pain that they are not alone in this. I'm going to stay here with you.
And it's okay if you don't know what you need. These types of numbers are built to help you figure out what you need. You call and you say, I don't know what I'm even asking, but this is how I'm feeling. And that crisis counselor is trained to help you walk through those next steps, whether it be connecting you to outpatient level services. Maybe it's connecting you to the appropriate resources. Maybe you need food support. Maybe it's connecting you to crisis response. But whatever it is, asking for help, reaching out is the first step. And maybe if you don't know you need that help, having that friend who recognizes something's not quite right, man, that can change everything.
Absolutely. Absolutely. And it could be they're just thinking about it, but there's also those folks that have a plan and an intention to act. So just asking the question, are you going to kill yourself? And if they say yes, okay, so you have an idea of intent, ideation, the thoughts. You can still ask some more questions. Well, how long have you been thinking about this? Have you come up with a plan on how you might do this? Do you have access to the method you're contemplating? So there's some other things you can ask even in this process. So when you call somebody and reach out to like 988 or our crisis line at 863-519-3744, or if you call 211 even, or if you call 911, they're going to be asking some of these questions. And you can be there, again, with the person. So understand what's available on campus, within your community, but you want to find somebody to partner with. If you're the person, if you're the listener to your friend, get some additional help, and do it right away. Don't say, well, we'll do it on Monday. It being Friday, it's like, oh, we'll do it on Monday. This is not something you wait for. It's
right. You do it now.
You do it now. Yeah, but I got a hot date. It's like, well, the date can wait. And doing that intervention quickly shows the support that's there, that it's not a burden. This is something that I'm taking very seriously. And all discussions of suicide should be taken seriously. And I know there's some people out there that, well, they just say it all the time. Yep. And that's hard to hear. Over and over again. As a supportive friend, it's like, well, after a while, I just kind of, this is just something they say.
Right.
That's true. But every one of those statements should be taken with some seriousness.
Well, and some of that, I think I hear that a lot with kids, right? So I hear kids have thoughts of suicide, and you have some people say, well, that's not real, or kids don't understand suicide. And I can tell you right now they do. There are some kids we've assessed over the years where they know they want their pain to stop, and they don't understand that suicide is a permanent solution. So there are some kids that just don't have the frame of reference to understand, like, oh, this is fatal, and this is lethal. And then you have situations where you have kids that truly believe that things are not going to get better, because when you're young and when you're, in adolescence, you have the rush of emotions and the rush of hormones, and you're feeling feelings for the first time ever, and they're magnified, and you've never felt this way before. So then when you have a heartache, you've never felt that way before. And in your life experience, because your life experience is finite, you haven't gotten around the corner. So you don't know a life past middle school. You don't know a life past this heartache. And so when people tell you, well, just get around the corner, it gets better, you don't know that to be true because it hasn't yet.
Right, exactly. There's a book on children who die by suicide. I think that's the title, but it's by Orbeck. And it talks about young children. I mean, we're talking 3, 4 even, who have died by suicide. That the pictures they drew, they did a lot of art therapy and play therapy indicators as far as what the child might be thinking. Children often don't have language that the adults have, so our adults' mind go to, well, they don't understand it because they don't have the concept yet. Well, it's there. Yes, they don't have the language. It's not mature enough for them to be able to describe what they're experiencing.
It's just raw emotion.
It's raw emotion, very raw, extremely raw, and especially during adolescence, where, that phase, the brain development at that point, the emotional part of our brain is fully developed during that time, and the part of the brain that says, hey, maybe we should think this through before we act, isn't developed yet. That's actually the last part of the brain to develop. And that doesn't fully develop until mid-20s. And in some cases, the research is saying possibly even into our 30s. So it's like, wow.
Well, and that's so hard because especially with, the age of social media and the age of the internet, you're putting kids and teens in adult situations and adult problems, but without adult resources to be able to handle that problem solving. And I say this all the time in trainings and with parents. I think sometimes we set expectations for our kids that are so much higher than the expectations we set for ourselves. Right? With behavior, with how they should react, with how they should handle change. Most people do not handle change well. For most people, their distress tolerance is very low. And kids don't have a lot of power over their day-to-day. And so if they have a schedule, if they have a routine, they can hold on to that as a sense of like, okay, I know what to expect. And then when that changes or when they experience disappointment and they have big reactions, it's hard sometimes to know how to manage that.
Yeah. And I do think social media does play in, us setting some unrealistic expectations, because what we see out there and being displayed on various social medias, we're seeing the best part of things. Yeah. And we're not seeing the work that it took to get to that one area, that one section,
Well, the bar keeps moving and you can't catch up.
Exactly. The bar keeps moving, you can't catch up. But again, that's our mature mind saying, oh, well, we understand that. Not the adolescent mind that's saying, oh my God, this is the world. And the impulsiveness that comes with some of that thought process.
And not having the maturity or the life experience to say, well, who cares about that bar?
Right, exactly.
That bar's not for me. Everybody has their own bar and everybody has their own path, and some of them intersect and some don't. And it's hard for kids to not judge themselves by someone else's bar.
Right. Their frame of reference. So, yeah. And so, even for kids, adolescents, young adults, older adults, there are resources out there. I've mentioned it before, I'll mention it again. The national hotline, 988, is one that people can utilize. I strongly encourage people to read it. You can call them or you can text them. You can do either one, 988. Locally, here in Florida, we're in Central Florida, people can call Peace River Center, their emotional support line, which is 863-519-3744. You can call 211 if you don't know what resources are in your community to help you find those resources. You can reach out to 911 even when we're contemplating this, and they'll get you to the resources. They tend to send, they're more of immediate concern and immediate risk kind of folks with 911. They'll send somebody out immediately to do an assessment, check on you, and do some things from there.
As we continue on in our podcast, we will be covering Baker Act assessments, how law enforcement can assist, and additional risk factors and protective factors when we're discussing suicide awareness. So keep tuned, and thank you for joining us.